All right, welcome to The Explainer. Today, we're talking about a type of medicine that you're not going to find in a pharmacy because it's actually on your dinner plate. Yep, we're diving deep into the world of therapeutic diets. These are eating plans prescribed by doctors, just like a pill, to treat specific medical conditions.
I love this idea. Imagine a medicine cabinet that fits on your plate. It really gets to the heart of what we're exploring. Think about it. Food that can actually lower your blood pressure, calm down an irritated gut, or even, get this, reduce seizures. And sometimes it can do all that with fewer side effects than traditional drugs. Now, to be clear, we're not just talking about eating healthy. This is something way more specific. It's about using food as a targeted clinical tool. So, what is a therapeutic diet officially? Well, the form of term is medical nutrition therapy, or MNT for short. And what that means is it's a super specific eating plan, totally custom built for a patient's unique medical situation. And here's the most important part. It's always supervised by health professionals. We're talking serious clinical practice here, not the kind of general wellness advice you'd scroll past on social media.
And that brings us to a really important distinction. We've got to separate the idea of just general healthy eating from what we're talking about today, which is basically a clinical prescription.
Okay, so let's break this down, because this is where it gets crystal clear.
On one hand, you've got general healthy eating, right? The focus is on overall wellness, the advice is kind of broad, eat more vegetables, and you're basically directing it yourself. But a therapeutic diet? That is a whole different ballgame. It's got a laser focus on very specific clinical goals. The prescriptions are incredibly precise. I'm talking down to the exact gram of protein or sodium. And it's always medically supervised. So one is a lifestyle choice and the other, that's a medical treatment, plain and simple. So why does all this matter so much? I mean, why is this field so critical? Well, when you see the sheer scale of nutrition's impact on our health, it really puts everything into perspective. Okay, check this out. On a global scale, diet is one of the absolute leading risk factors for death and disability. I want you to let that sink in. It actually ranks higher than many individual medical conditions. So what we eat or don't eat contributes more to poor health than a lot of the diseases we hear about all the time. That just shows you how urgent and important it is to get nutrition right, especially in a clinical setting.
And here's a stat that might surprise you, and it points to a huge problem happening right inside our hospitals. Somewhere between 11 and 30%. That's a big range, but even the low end is shocking. Of hospitalized patients are affected by malnutrition. This is exactly where these therapeutic diets become so incredibly vital. They're a direct intervention for a problem that can make recovery so much harder.
Now, for a diet to be considered a real medical treatment, it can't be random. It has to follow a really strict set of rules. This isn't about guesswork at all. It's a formal scientific process.
The whole approach really stands on four main pillars. First up is individualization. This isn't a one-size-fits-all thing. It's completely tailored to the patient, their diagnosis, their age, their specific needs. Second, it has to be evidence-based. That means using eating patterns that have been scientifically proven to work for a certain condition. Third is safety and monitoring. You can't just set it and forget it. A team is constantly watching for any unintended consequences, like, say, nutrient deficiencies. And finally, it's all about multidisciplinary delivery. This is a team sport with doctors, dietitians, and nurses all working together.
Okay, so that's the theory, the how it works. But let's get into the really cool stuff, what this looks like in action. We're going to look at some specific diets being prescribed for some very different conditions, from high blood pressure all the way to epilepsy. This table here tells some pretty incredible stories. Take the DASH diet. For someone with high blood pressure, a doctor can prescribe this, and it's proven to reduce systolic blood pressure by a good 5 to 7 points. Or how about irritable bowel syndrome, or IBS? A dietitian-led low-FODMAP diet can seriously improve pain, bloating, and other tough symptoms. And this one is just amazing. For some children with epilepsy that doesn't respond to drugs, a specific ketogenic diet can lead to a seizure reduction of more than 50% in about 38% of cases. And for someone with chronic kidney disease, a special renal diet can actually help slow down the progression of the disease. I mean, this is food as precision medicine, right there. Of course,
Having the perfect plan on paper is one thing, but actually putting it into practice day in and day out, that's the real challenge. So let's talk about the reality of adherence.
So, what does that patient journey actually look like? Well, it's a very structured process. It all starts with a deep dive assessment, looking at your clinical status, your lab results, your diet history, the whole picture. From there, you move into goal setting. You and your team work together to define really clear, measurable clinical targets. Then comes the education and counseling piece. This is where you learn the nuts and bolts: food selection, portion control, how to make it work in your life. And crucially, it doesn't just stop there. There's constant follow-up and monitoring to track your progress and tweak the plan as needed. It's a true partnership. So let's be real about the benefits versus the limitations. On the plus side, the benefits are huge. You can reduce symptoms, improve key health markers, and sometimes even rely less on medication, which is fantastic. But it's not always easy. Sticking to the plan can be really demanding, and if you're not careful, some of these restrictive diets can put you at risk for nutrient deficiencies. And that brings us to what is maybe the single most important point of this whole explainer. Medical oversight isn't just a nice to have, it is absolutely essential to make sure the diet is both safe and effective.
So if you take away just one thing, let it be this: therapeutic diets are not just healthy eating advice. They are precise, targeted interventions that are grounded in solid science. And that really leaves us with a fascinating question to chew on, doesn't it? If food truly is medicine, if it can be prescribed with this level of precision and power, what's next for our health? What does that mean for the future of medicine, for our hospitals, and for how we each manage our own health? It feels like that medicine cabinet on our plate is just beginning to be unlocked.